Hi, welcome back. My name is Morgan. I'm a student physical therapist assistant.
And I'm Lydia. I'm a student physical therapist assistant. And we are going to talk to you about some stretches and exercises that you can do at home. And we're going to be instructing you through those and also discussing what you just have been through with your total knee replacement and some precautions and things to avoid.
So while Lydia sets up her first stretch, I'm going to go ahead and take you over to the skeleton and discuss your diagnosis if you want to follow me. So what you just had done was a total knee arthroplasty, which is also known as a TKA, and you had it on both of your knees. So essentially this procedure resurfaces your knee of the damage that the osteoarthritis in both knees caused. And this is a major reason that you had knee pain and trouble with standing for long periods of time. So now that you're recovering from your surgery, just remember that you're still actively healing and your knees will be sore, stiff. It may become swollen over the next few weeks up to months, and then your incision sites will be pink and tender, so you need to make sure to be careful around these areas.
Please do not touch or scratch the area or remove the steri strips from your incision sites. You are in an early stage of healing and it would take some time for things to calm down and return to normal. Be patient with yourself and the healing process. Since you have steri strips around your knees from your surgery, please don't force your knees to bend so far that it causes your steri strips to reopen. All right, so it's also very important that you do your ankle pumps when you're laying in bed, or it's going to really help reduce the risk of getting a blood clot in your legs. So I want you to make sure you point and flex your toes 30 to 50 times every 30 minutes, or as often as possible. I cannot stress enough how important this is to do so that you do not get a blood clot.
All right, it is very important that you make sure that you do these exercises on your home exercise program. This is going to help reduce pain, limit the stiffness in both of your knees, and ultimately get you back to where you want to be with hanging out with your grandchildren, gardening, and golfing again. It is very important that while you're doing these exercises that you do not overdo it. You want to make sure that if you're getting to the point of pain that you kind of relax a bit and you take a rest break. These rest breaks are okay and they're crucial for your healing, so they are necessary. So just make sure to keep that in mind while you are doing these exercises, and let's continue on and get to that first stretch.
All right, we have Sam here as our patient, and we're going to be instructing you on how to do a heel prop stretch. And as you can see, she has 2 chairs. We're going to have a towel rolled up underneath the back of the heel. And this is to just stretch out the back of the knee, and we want gravity to take the knee down. So as she's relaxing into the stretch, the knee is slowly going to start to come down, and the longer you hold the stretch, the better this is going to be. So we want you to hold this for 3 to 5 minutes to build up to doing it for 10 to 15 minutes every 1 to 2 hours throughout the day, 7 days a week. I want you to start with one leg first, one leg at a time, and then do the other leg. She switches, and I don't want you to work into pain. You're going to feel tightness on the back of the knee, which is normal, and just don't work into pain, but you will feel that stretch working. And now Morgan is going to show you the next stretch.
So now that we are on the second stretch, I'm going to be instructing you on how to do the prone quad stretch while laying on your stomach. So to set this up, I want you to be on a sturdy surface. So this could be anything like the floor or a sturdy countertop or kitchen table. And then also I want to make sure that you have like a pillow under your hips for comfort. And then key thing here is to have a towel roll or a small folded towel above your incision site, so then you do not create any more irritation that is already present, and you also don't want to do anything to where it can cause the incision site to open up. So first thing you want to do after you get all set up with your location is to grab a strap, and this could be anything like a leash or a belt at home, anything that you can create a loop to wrap around your foot. So you want to put the loop around your foot, and you want it to be tight enough to where it doesn't fall off, but loose enough to where you don't cut off any circulation. And having shoes on could be really helpful to keeping that grip there. So you want to wrap it around your foot, and then on the same side of the body, you want to bring that strap to where it's over your shoulder. And then as you pull the strap over your shoulder, you're going to be pulling your leg so there's more of a bend in your knee. And then once you feel the tightness, and the tightness you're going to feel on the front of your thigh, make sure that once you feel that tightness that you hold in that position for 30 seconds. And then once you complete those 30 seconds, you're going to return with your foot back onto the surface that you are laying on, and you're going to repeat the same steps. And then I want you to do these 3 30-second holds, and then I want you to at least do these 3 times a day, 7 times a week. And since you did have the procedure done on both knees, I want you to make sure that you do it on both sides. All right, and also a key thing is not to work into the point of pain. And then also, when you do these stretches, they should feel mild to moderate, and it should not go past that point. So if you're getting past that point and into the point of pain, that's when I want you to stop and let us know. All right, so now that we've finished this stretch, let's go ahead and get into some strengthening exercises.
All Alright, so for our next exercise, we're going to be doing some mini squats. But before you get to any strengthening exercises on your program, I want to make sure you do the stretching exercises first. Always do those first before you start your strengthening. So Sam here is going to be performing a mini squat. So she's got her thighs close to the back of this, touching the back of this high-low table, and we have it adjusted so she's not going to have to go too far down. You want to only squat to the level of the table, so the mat. So she's got her assisted device. It's very important that you use this device, especially as you're building up your strength again, so for balance. So she's got her hands already on the device, and she's going to just bend at the hips and knees, look forward, standing up tall still, and touch her bottom against the mat. So she's going to continue to do that. I want to make sure you're going to feel some burning on the top of your thighs. That's normal. I don't want you to work into pain. And also make sure that you do look forward, don't look down. And we want to do the 3 sets of 8 to 15 reps of these mini squats. But the goal is fatigue, not pain. So I want you to work into fatigue. If once 8 to 15 start to become easy, then I'm going to want you to do a little bit more. But right now, let's just say 8 to 15. And I want you to do perform these 1 to 2 times a day, in the morning and then the afternoon, 5 days a week. And after this, we have just one more exercise for you to go through, and Morgan's going to show you that next.
All right, so now I'm going to instruct you on the second strengthening exercise, which is called a clamshell. So I want you to start by laying on a sturdy surface. So this could be anything like the floor, a bed, or a sturdy tabletop. And you're going to be laying on your side. And then I want you to do with your arms is to have one supporting under your head, as Sam has here, and the other hand is going to be lying on the mat to stabilize yourself as well. And then, as you can see, both of her knees are bent, and then her feet are close together. So to do the clamshell, you're going to keep your feet together, but you're going to take the top leg and bring that knee up towards the ceiling. And once you do that, you're going to hold it up at the top for a few seconds, and then lower it back down. And as you can see with Sam, she is not letting her hips roll back, so you want to make sure that you are staying within that same plane of motion. And you should start to feel a slight burning sensation on the outside of your thigh, and that burning sensation is normal and it is good. That just means that your muscle is working the way it needs to. And what I want you to do is perform 3 sets of 15 to 20 reps. I want you to do these about 1 to 2 times a day, 5 times a week. And make sure that you are doing both sides. So once you complete this first, or the 3 sets, that you flip over and do the other side so that you can strengthen both. And once again, as we have stressed this enough in this video, do not work to the point of pain.
Yay, you've made it to the end of your home exercise program. Congratulations. Make sure that you continue to do these exercises as prescribed, because it's going to get you closer to your goals and get you healing and feeling much better that much quicker.
You see our friend Frank here? He didn't follow through with his home exercise program. You see what he looks like? He's just bones now. Let's not get to this point. Do your exercises.
Do your exercise. You can do it.
Woo!